So the question is, why do the anesthesia affect the body so badly? So the answer to this question, it could be as simple as, it could be the effect comes from the local anesthesia, which is the numbing that we normally give for patients, or it could be the anesthesia or the IV medications, IV medication that we use for the anesthesia, that can have an effect on the body also. For example, one of the most common things that I hear from my patient, whenever we give the numbing medication to our patient, their heart starts beating really fast, and sometimes it could be a little bit fast, and sometimes it could be really fast, and the patients get an anxiety attack. Patients got like really panicky because now they're starting to have their heartbeat like really fast. So one of the medications that is in the local anesthesia that we use, or the numbing medication we use, that makes your heart kind of beat really fast. And like I said, if it beats like a little bit faster, you may be okay, but if it is really fast, then now you're going to have like a panic attack or some kind of an anxiety attack from that. But it goes away like after a while. However, sometime of patients, like it may last longer also, and that may be one of the reasons the patient may be asking this question. Hey, can you do something else? My heart beats really fast, from the numbing medication usually given at the dentist. So we do have some alternative medication that we can give you with a particular type of local anesthesia that does not make your heartbeat faster. So if you do have those conditions, please talk to your dentist, and they should be able to give you some kind of an alternative local anesthesia. And the other part that I mentioned earlier, the IV medication that we use, and no matter what it is, so depending on your sensitivity to the medication, sometimes I may give like a very small dose, and you're going to get sleepy for the rest of the day. And sometimes I give a very high dose, and you're just able to walk out of the office absolutely no problem at all. So depending on the sensitivity, the anesthesia medication that we use or the sedative medication that we use may have a very short acting or a prolonged effect in your body. And then the other thing that I normally hear is, after we use the anesthesia medications, patients tend to have some type of a nausea or vomiting sensation, which is not uncommon from the narcotic type of medication that we use. So those are the most common things that we hear: patients feeling sleepy, or heart beating kind of fast, or nausea or vomiting. Those are the effects that the anesthesia, any type of anesthesia used in a dental office, can have on your body.
All right, I think we have